Tony, data analytics is a phrase that's used often, almost a buzzword. But how does WAEPA utilize data and data analytics for making strategic business decisions?
So Shane, I think first off, we have to make sure that we understand that WAEPA is not a data aggregator, right? So we're not just consuming data for the sake of consuming it. So if you take it into the next step then, what we do is we collect primary data, usually directly from our members with their volunteering information, such as demographics and other information like that. And we also leverage surveys of our existing members and also of potential members, most importantly, to get an idea of what our members and potential members want out of WAEPA, what else they want besides what we're already giving them, et cetera. So that's kind of the way that we approach data analytics on our side. And then we use that data that we collect from the members and potential members then to guide us on our decisions as we move forward as to how we want to advance WAEPA's programs to these members and potential members.
So taking that a step further, how does WAEPA use data analysis to make new product decisions?
So great question, and there's two examples that I'd like to talk about briefly where WAEPA has leveraged the data we've collected to make a strategic decision that we believe is going to benefit the members. The first of which is in 2017, we launched a partnership with Ernst & Young to offer financial planning to our members. So what that does is it enables our members at no cost to them to access a certified financial planner and discuss anything that they would like to in relation to building a financial plan, preparing for retirement, saving for college education, investing in their TSP, investing in privately as well. Basically, from A to Z, the EY financial program can help build their financial future with them. And again, that's at no cost to the member, and that's also 100% confidential. So WAEPA pays for the program essentially on behalf of the members, but other than that, we don't collect any data. That's one instance where we don't collect data, is to protect the privacy of the individuals and their work with the certified financial planners. So that's one great example of a need where we delivered financial wellness that was a gap in the federal benefits. So that was a great benefit, and our members have really taken advantage of that in large numbers over the past 7 years, which is great. The second product that we have brought on board was in 2018, and this really kind of helped fill the void again in federal benefits in the kind of long-term care space. So while WAEPA does not offer long-term care, what we do offer is a rider called a chronic illness rider, and that attaches to your group term life insurance that we've been offering, for 80 plus years. And so that enables you to be able to draw from your term life insurance in the event you cannot do 2 of the 6 ADLs and or you have a cognitive impairment. So it acts similarly to long-term care, but it is not a long-term care product. But our members have added it to their policies in enormous numbers. It is our fastest growing product by percentage in WAEPA since we introduced it in 2018. So it is a tremendous success, and it's a credit to the work that we've done via surveys and just listening to the pulse of the federal workforce. What do they want, and where can we meet them where they want to be met?
So what is next as we grow products and services for the members?
Mm-hmm. So the sky is the limit in some ways with WAEPA. Now, as a nonprofit, we are limited in the association space of some products and services we can't offer. But having said that, there's lots of room for growth for WAEPA as we move forward. It's making sure we meet the needs of our members and potential members. And so one of the many ways we can do that, quite honestly, is it starts with the term life program, again, that we've had for 81 years. So we are not done with that program by any means. We can increase face values as the needs of our members continue to grow. We can add additional riders to that program as well. As I said earlier, the chronic illness rider has been a tremendous success. There are other riders that are available that attach to term life that we can also add if our members tell us it's going to be a benefit to them, then we can absolutely explore that. Other things that we can do as well is we can look outside our current environment with our members, and can we expand the eligible membership pool to WAEPA as well? We've done that recently with ensuring that former feds are eligible members in addition to current feds. But perhaps that pool can expand a little bit wider, right? You know, there are family members that rely on federal employees just as much as spouses do or dependent children do. So perhaps that's an avenue we can go down as well. And then lastly is we're not at the end with products, right? We have our short-term disability product. There are avenues to expand that and provide more comprehensive coverage if need be. And there are also other products out there, or partnering with others in strategic partnerships with other folks that do maybe offer the health side that we haven't really gotten into, and perhaps we can partner with them on the life side and create a winning combination for that partnership, but most importantly for our members.
Tony, thank you. And thanks for your service to WAEPA, and you've done a lot of excellent work. And our growth is directly attributable to you, data analytics, the whole team. Thank you.
Yeah, thank you. Appreciate it.